Turn up your speakers. Turn up the volume. This is Dr. Ophir Isaac coming at you from Allcare Physical Therapy and the Pain-Free Maverick. And I wanted to share with you today a quick question that most people come to the clinic and ask me, specifically runners. So if you're a runner, listen to this. This is totally going to help you out. The question is, my doctor said I can't run. Is that true? Now, before I answer that question, I'm going to ask you a question. Have you been told that running is bad for your knees? Because I guarantee you, you're most likely watching this video because you probably have some knee pain. And that's probably the most common diagnosis that people get when they go to the doctor. They have runner's knee, patellofemoral syndrome, or tendinitis of their knee, and they're told they can't run. But I'm going to share something super important with you today, and it's shocking. Running is good for your knees. And before I answer that question, I'm going to explain to you why running is good for your knees. The first thing I want you to understand is that there are two reasons why running is good for your knees and how you can improve the strength of your body and your knees and prevent arthritis and prevent what they call degenerative changes of your kneecap or a breakdown of your kneecap and ligaments. And you can run for as long as you want. Here are the two most important things you're going to learn in this quick video. Okay, so keep watching here. The first one is hip mobility, and the second one is ankle and foot mobility. These are the two most important things that I'm going to teach you, and how that works with the word form. Running form is the most important thing. If you can get this concept and you can learn how to run with better form, and you get better hip mobility and better ankle foot mobility when you run, you're never going to have knee pain again. So are you watching? Here we go. Most runners run incorrectly with their hips. They raise up their knee very high or midway high from the floor, and the correct way to run is to swing the knees low. Swinging the knees low keeps the knees soft, so when you hit the ground, your knee isn't locking out. Runners that run the wrong way with their hip up hit the ground hard and then hyperextends the knee, and that causes problems in the knee. So remember, if you're running correctly, you're going to use good hip mobility, which basically means your hips will do the work and not your knee by swinging your knees low, and you'll be following through with a bent, soft knee because your knees are like shock absorbers. If you keep them locked, that's going to hurt your knees. So that's going to make your hips work better, and you'll be able to follow through properly. So the second thing about form, correct running form, is a lot of runners, what I found is if you ever go ahead and watch runners in the street or wherever you run, a lot of runners will run and they're either twisting their knee in or their hip in like that, or their foot kind of falls in. And look what happens to your knee when that happens. Your foot pronates or flattens. And that is bad ankle mobility. That's not the way you're supposed to run. That is the wrong way to run. So if you're listening, this is the way to run. You want to make sure you have good ankle mobility. Now, how do you do that? Well, sneakers or good shoes are only part of the story. Make sure that when you run, make sure you're listening to this. This is the key point here. Make sure when you run that your toe, your big toe, is pointing in the direction that you're running so that your knee is aligned with your foot and your knee is soft and slightly bent. If your knee and your foot are pointed in or pigeon-toed like this, every time you hit the ground, you're going to injure your knee. So you want to keep your knee soft and your knee aligned with your foot. Just imagining twisting your hips out when you run a little bit or squeeze your butt. That's going to twist your knee out. And those are the two most important things. So the answer is running good for you? Absolutely. And if your doctor says you can't run, is that true? No, it's not true. You can run, and you can run safely if you have good form. If you have any questions, you can leave a comment below or go to the website www.allcarept.com.
A 9-10 and
okay.
Almost to tears.
Okay, can you show me where on her ankle you're having the pain?
Down here
okay.
And down here.
Alright, balance on it.
Ow.
Okay, 2 to 3 seconds. Okay, go the other way. Stand on the left side. Any pain with that?
Slight.
What's the level of pain now?
Maybe 1 to 2.